I just want to remind all our speakers that you all have 2 minutes for your testimony. And our first speaker for this afternoon is Mr. John Anderson.
Merche, did we do a countdown? And I have a couple of announcements before that.
Got to start the council meeting first.
Right.
Queen, are you doing
Do we have Equin? I'm sorry, Merche, I thought you were subbing in. I didn't look at the participants. Hi, Equin.
Hi.
Maybe you were on vacay. Okay. Yeah, we're ready whenever you want to give me a countdown.
We are currently live.
Oh, terrific. Okay. Good afternoon, everyone, and welcome to the Montgomery County Council's August 5th session. Before we sit as the Board of Health, we have an announcement. The public hearing on the spending affordability guidelines for the FY23 capital budget and the FY23 to 28 capital improvements program will be held on September 21st, 2021 at 1:30 p.m. So now the council can sit as the Board of Health. We have the introduction of a resolution to adopt a Board of Health regulation to prevent the spread of COVID-19 in the county. We certainly didn't want to be here, but as we've done from day one, we want to be attentive to follow the science and the recommendations of our public health team and take necessary precautions to keep all our residents safe. Even though we have among the highest vaccination rates in the nation because of the hard work of our public health team and our residents, our health officials have determined that this variant is highly transmissible and requires action to reduce the spread. Our intention is to ensure that those in our community who aren't eligible to be vaccinated, such as children under the age of 12 and our immunocompromised residents, are protected. No one wants to go back to wearing masks, which is proposed, but in the absence of a 100% vaccination rate, masking is one of the easiest and most effective ways to prevent the spread of the virus and protect public health. So that's what's under consideration today as an indoor mask requirement. We are hoping that this will be a short-term measure that will help us reduce the spread of the dangerous Delta variant, and we continue to urge all eligible residents who are not vaccinated to get vaccinated immediately. Let me first recognize Senior Legislative Attorney Bob Drummer and Legislative Attorney Christine Wellens to walk us through the packet.
Sorry, unmuting would help. Thank you, Mr. President and council members. The proposed Board of Health regulations before you relate, as the council president said, to indoor masking requirements in public areas of the county. And it would be a countywide regulation. And this masking mandate would be triggered if and when the county becomes a community of substantial or high transmission, as determined by CDC metrics. And as you may know, the county currently is in the moderate transmission status category, but it is anticipated that within the next couple of weeks, we may move up to a substantial level. And as the CDC has recommended, even individuals who are fully vaccinated, should wear masks when they're in indoor public areas if they live in an area of substantial transmission, community transmission, or higher. So again, that's what this order would do is if and when we reach that status of being in the substantial or higher community transmission, then this masking requirement would be triggered. And what would happen under the regulation that's before you is that the health officer would be responsible for monitoring and reporting to us on the transmission status. As soon as if we hit that substantial status, then he would need to both advertise to the public and of course inform the Board of Health and the county executive that we are in that status and that the mask requirement has been triggered. I believe that's the general framework, Mr. President. Happy to try to answer any questions. Thank you.
Thank you. Any questions from colleagues? Okay. Oh, Councilmember Reamer.
Just to clarify, so will go to public hearing, and then we'll have a motion, and we'll have discussions on the proposed regulation at that time.
Sure. After the testimony, yeah.
Thanks.
Okay. So if there are no questions at this point, then now the council will sit as the Board of Health. We'll have the introduction of a resolution to adopt a Board of Health regulation to prevent the spread of COVID-19 in the county. Ms. Salu, do we have speakers? Please introduce the speakers for this public hearing.
Yes, good afternoon. Our first speaker for this afternoon is Mr. John Anderson. Mr. Anderson, you have 2 minutes for your testimony.
Thank you. First of all, my name is John Anderson, and I own a retail store called W. Curtis Draper, 134-year-old small business located in Delray, on Delray Avenue in Bethesda. I'm a bit disjointed. I apologize. I've had one of those days where everything that could go wrong has gone wrong. When I say we're a full-service tobacconist, by that I mean we sell premium cigars, pipes, cigar cutters, lighters, humidors, and accessories that go along with that hobby. I also have a lounge and an indoor patio. I'd like to state on the record that I am in favor of mask mandates. I've actually continued to wear mine even though it hasn't happened or it has been removed. I think it's important, but I think that I want to have a reasonable dialogue with the council about that and what's right and what's not. Unfortunately, my business was forced to close for over a year, my lounge, and my business suffered to about 70%, to the point where I almost had to close and lay off my 8 employees. My family counts on this business, my daughter, my wife, and my 8 staff members. So what I would like to do is say treat cigar lounges like you would treat restaurants and bars. And that is we wear masks when we come in. If we sit and we're socially distant, which the lounge has been set up that way since the mandate was removed that social distancing wasn't important, we're still set up that way. And it's very important. We have a state-of-the-art air filtration system that replaces 110% of the air every 10 minutes, as well as 5 different HEPA filters throughout the store that remove particulate matter. I don't think there's any restaurant or bar in Montgomery County that has something that is quite as robust. But what I would really ask is to exempt cigar lounges from the mask mandate when they're seated and enjoying a cigar in the lounge. And I think that's very easily doable by using the licensing agreements, right? We have a retail tobacconist license, and if a retail tobacconist has a lounge and they're in good standing with the county and the state, they can operate their lounge. Customers, when seated, keep their masks or don't need to wear masks, but when they come in and out and shop, masks are required.
Mr. Anderson, sorry to interrupt you, sir. Your time is up.
There's no timer that shows, so you know, so I had no idea how long I was speaking, but thank you for your time. I appreciate it.
That was my mistake. I'm sorry. Every speaker has 2 minutes. Thank you so much for your testimony.
Okay. Our next speaker is Mr. Matt Lieber. Mr. Lieber, you have 2 minutes for your testimony.
Good afternoon, members of the council. Good to see you again. Hope you're enjoying your vacation. I'm here. I'm actually in support of the reinstituting of the mask mandate. We actually tried to keep it longer after you guys lifted it for our indoor activities just because of our population. It just became very difficult to enforce when we were the only entity still doing it. So we are in favor of it. I do have some requests to modify some language in the order. And Councilman Friedson, I understand that one of your amendments will address this, but I'll just bring it up anyway. You guys have a mechanism to institute the mask requirement. I would like to see the reverse put in there so the general public knows what the goal is on the end. So if we get X number of days at medium or whatever you guys decide, that we know that it's coming off. That was a big request that I think you guys heard frequently over the past year when we had mandates in place. I think that's a good way to let the public know what's going on. Secondly, I'd like a clarification on the exemption for physical activities. This is something I've asked for a long time. And actually, Councilman Friedson, your response I got from your chief of staff is kind of to the point. The response was this language matches what the state is, and I completely agree it does. But for the past year, this county has had a different interpretation of what that means versus the state, where the state says physical exercise, you don't have to wear a mask. This county said you do. So whatever you guys decide, I just would like it to be very clear so we don't have to have the argument with our customers about what the county's intentions are. And the last one is, I hope we do stay away from a mask mandate for outdoors. I think the data and the science does still show that the outdoor activities are not a high risk, even with the Delta variant. So I hope we can still stay with just indoor mask mandates at this time and not outdoor. And other than that, I fully support what you guys are doing, and then look forward to working with you moving forward. I can give back the rest of my time.
Thank you. Our next speaker is Mr. William Fitzmaurice. Mr. Fitzmaurice, you have 2 minutes for your testimony.
Thank you. As many of you know, Montgomery County has one of the highest vaccination rates in the country. With this being the case, I am puzzled why indoor masking is even being considered. Some have argued that breakthrough infections can occur, and while that seems to be the case, according to the CDC, there's only a 0.06% chance of hospitalization in vaccinated individuals and a 0.01% chance of death. In fact, only 325 Marylanders are currently hospitalized for COVID, many of them probably unvaccinated. This is in a state of 6.1 million people, Montgomery County having roughly 1.05 million. The 7-day average for deaths, by the way, in Maryland is 6. Some have argued that these restrictions are to protect the unvaccinated, but those individuals have had their chance and weighed those risks. Some have argued that they're to protect those under 12 who are ineligible. However, as we have known for the majority of this pandemic, children are largely not at risk. In fact, only 10 individuals under the age of 18 died in Maryland since the beginning of this pandemic. And despite the panic over the Delta variant, 7 under the age of 18 have died in the month of July in the US as a whole. While all of those deaths are tragic, I do not think they merit a government mandate. These restrictions are unnecessary. They're uninformed, and at this point, I think it is time to put an end to a measure that was originally intended to be temporary. Thank you.
Thank you. Our next speaker is Mr. Michael Eberhardt. Mr. Eberhardt, you have 2 minutes to give your testimony.
Thank you very much. My name is Michael Eberhardt. I want to start by thanking the members of the council for giving me an opportunity to speak. I also want to say that I am neutral to an indoor mask mandate. I can see valid points from both sides. The issue that I have is that you are now before you considering regulations to prevent the spread of COVID. And I'm curious if we still think this is an attainable goal. With due respect to this council and very talented and dedicated scientists and doctors in this community and around the world, preventing the spread of COVID has eluded us all for more than 16 months. How long are we going to chase a brass ring that's simply unreachable? It's spread in spite of masks, it's spread in spite of lockdowns, it's spread in spite of all of our genuine best efforts. Masks and lockdowns, we now know, did not slow the spread or flatten the curve. And now vaccinated people spread the virus as readily as unvaccinated people. Preventing the spread just is not going to happen. What we as a community, I think, and I'm proffering, and a society have done is to carry a once useful metric, cases of infection, into a brand new environment that has rendered that metric useless. The new environment is one that possesses safe and remarkable effective vaccines. With the vaccine serious complications, as mentioned by the previous speaker, from a case of COVID is in the percentile of a percentile. Our objective has really only and always been to reduce the loss of life and serious complications from COVID, and we've accomplished that. The county's COVID hospital bed usage remains in very low utilization. I'm assuming this includes children as well and those ineligible for the vaccine. Even still, cases rise. It's no puzzle. Vaccines work, and what we have set out to do is being done. We're winning. To reintroduce an objective to stop the spread of COVID is to lead us all to another bout of failure. I'm speaking today in an attempt to influence developed thinking, not necessarily a particular position for or against masks, but just developed thinking in the new environment. We should not be thinking of the tactics of last year.
I'm sorry to interrupt you, sir, but your time is up.
Thank you very much.
Okay. Our next speaker is Ms. Jennifer Chen. Ms. Chen, you have 2 minutes to give your testimony. Is Ms. Chen with us? Okay, we'll move to the next speaker and come back with Ms. Chen. Is back on the line. Our next speaker is Mr. Chris Torp. Mr. Torp, you have 2 minutes to give your testimony.
Good afternoon, council members. My name is Chris Thorpe from 2512 Brown Farm Court, Brookville, Maryland. Thank you for listening to your constituents. 18 months ago when this all started, we did not have the information that we have now. The situation we are in now with the vast majority of the county vaccinated is dramatically different than a year ago and so requires a different response. The Delta variant is something to be concerned by, but our vaccines protect us. Data from the UK shows how the spike in cases did not lead to anywhere near a spike in hospitalizations and deaths that was similar to last year. We must remain committed to following the data and the science shows that a community like ours is well vaccinated will not be impacted like a community that isn't as well vaccinated. I would urge the council members to not solely use case numbers as the metric that triggers further COVID measures such as masking and business closures. A much better metric to use, I believe, is to heavily weight hospitalizations per 100,000 in conjunction with cases to more accurately reflect the danger facing our community. I also support a sunset clause, as mentioned in yesterday's meeting by Earl Stoddard, that would trigger restrictions going away once certain numbers are reached. I own and operate 2 small businesses. One of them we are trying to close on a deal worth hundreds of thousands of dollars and will bring employment opportunities to the county. But everything is being held up because of fear. Not fear of the Delta variant, but fear that the county will enact policies that are not representative of the risk that is assessed to our community. Our community is required to have an extremely high vaccination rate, and therefore we should react to this latest threat differently than a community that hasn't done what we have done. Thank you for your time. Appreciate you hearing me, and I give back the rest of my time.
Thank you. Our next speaker is Mr. Robert Van Alstyne. Mr. Alstyne, you have 2 minutes for your testimony.
Thank you. My name is Robert Van Alstyne, and I would like to thank the council for their time today. I strongly oppose reinstating a mandate for Montgomery County. Dr. Gales and the county do deserve tremendous credit for having, according to the CDC, 85% of county residents over 18 fully vaccinated, including 94% of those aged 65 plus. With these incredible vaccination rates, who is the council trying to protect with a mask mandate? Schools will be fully masked in the fall to protect our kids, and the most vulnerable population is 94% protected. Are we really trying to protect those adults who have made the selfish decision to not be vaccinated? They've made a choice to not care about their health or those of the community. A mask mandate will give them no reason to be vaccinated. At this point, if they get COVID, they can look in the mirror to see who's to blame. Masks destroy social interaction and will cause considerable damage to small businesses in the county who are still struggling to survive. If the council wants to show its seriousness about stopping the virus, institute a vaccine mandate in the county. Allowing unvaccinated adults to hold the community hostage is foolish. If they don't want to be vaccinated, they need to be cut off from society to protect the 85% of the county that have made the right choice. I was an early adopter of masks back in March 2020 because that was the only tool I had at the time to protect myself and my family from COVID. Masks are the equivalent of relying on a life jacket to survive a sinking ship. It's a last-ditch effort to buy you time while awaiting rescue. Luckily, due to scientists, many of whom are in Montgomery County, our rescuers have arrived with a life-saving tool, the vaccine. With the free vaccine, every adult has been upgraded from having to rely on a life jacket, hoping for rescue, to having a rescue yacht, compete with a professional crew, begging them to come on board and be returned safely to shore. If individuals decline to board the rescue yacht because they're unsure of the yacht's safety or they don't trust the yacht's professional crew, that's on them. The county has done its job, providing them the tools for rescue. A mask mandate for vaccinated people is asking them to keep a life jacket on even when they get back to shore. Since every adult in the county has had a chance to be rescued by a safe and effective tool to protect themselves and those they care about, I strongly oppose a mask mandate. Thank you.
Thank you. Our next speaker is Mr. Gary Fellman. Mr. Fellman, you have 2 minutes to give your testimony.
Thank you very much. First, I'd like to say I fully support the council's effort to keep county residents safe, but masks are only a small portion of this effort, and are probably not the most important. As of 26 July, CDC guidelines still recommend that individuals remain 6 feet apart when indoors with people outside of their households. And in fact, more importantly, they strongly recommend that people avoid crowds as well as poorly ventilated spaces. There's recent MIT research published on April 27th on the Proceedings of the National Academy of Sciences that states that the single most effective way to reduce infection, and I quote, is to avoid spending extended periods in highly populated areas. Recent events in Nantucket appear to support their research. And given this, and the fact that in a couple of weeks we will, through openings of universities and schools with the Jewish high holidays, be putting a large number of our county residents in a situation where they'll be spending extended periods of time in poorly ventilated spaces. I am wondering what the county council is planning to do about this risk as identified by MIT. Thank you very much for the time and opportunity.
Thank you. Our next speaker is Ms. Lynn Sokolsky. Ms. Lynn, you have 2 minutes.
Hi, I'm an attorney in Pennsylvania, but I've been living in Montgomery County for many years, and I became involved with holistic health. That's why I became an attorney, to protect children. I care very much about children, but I think children need to be taken care of by families that are mentally well. People who are in 12-step programs and need mental health counseling are not able to get what they need. Zoom is not a replacement for real live people. This is a huge mistake just to say the CDC says this and therefore we have this number and it triggers it. We're not thinking of nuances. I propose you postpone this vote until you can have more of a hearing from more people. I was on the waiting list for this, even though I tried to get on a couple of days ago. I think more than 10 people should be allowed to speak. This is a very deep psychological issue for people. When they can't see each other, and someone mentioned the high holidays, synagogues, churches, etc., are a place to give people spiritual support to get through this pandemic. There's no end in sight for this pandemic. There will be other variants. As long as people are not vaccinated around the world, we're going to have this. We just heard about Lollapalooza in the Chicago area, where even though people were outside and supposedly having vaccine passports, people were jumping over the fence and some people were being waved in. It was indiscriminate. We need to be tougher about, do we mean that vaccines are really the answer? And if they are, what are we going to do about it? We're spending so much time worrying about these masks instead of worrying about the vaccine. Still half the people in this country that work in nursing homes are not vaccinated. That to me is criminal. We need to go deeper, and just these CDC guidelines change daily, weekly. The World Health has said, oh, maybe people can't get their third vaccine until other people get their first, but people aren't working together. Please, please, please go deeper than this. Thank you for your time.
Thank you. And that concludes our speakers list for this afternoon, Mr. Council President.
Thank you so much, Ms. Salu, and thanks to all our speakers. This public hearing is now closed. Next, we can take up the resolution to adopt a Board of Health regulation to prevent the spread of COVID-19 in the county. Is there a motion to approve the resolution?
So moved.
Second.
Councilmember Rice moves. Councilmember Reamer seconds. Okay, we can have discussion of the proposed resolution. Was that you, Councilmember Reamer?
I did second it. Gabe did as well.
Oh, I thought I saw a wave. Sorry.
I was going to text you, so put me in the queue.
Thank you.
Wherever you have.
Okay, Council Vice President Albornoz.
Thank you, Mr. President. I appreciate the thoughtful testimony, and certainly we have all received feedback, both formally and informally, since this discussion came up. I do want to say a few things up front. The first is, as we've learned over the last year and a half, it's especially effective for us as a region to invoke policies collectively together. And we know fundamentally that masks have absolutely worked, and that they have been an important component in stopping the spread of this awful virus. And we all should feel tremendously proud of the success of our vaccination efforts, as was noted by several people that testified, with over 80% of our population, which is remarkable. And that is not, that's of the entire population. It's an even higher percentage when you consider people eligible for the virus. But as we know, and as was acknowledged by several of the speakers, Children under the age of 12 do not have access to this vaccination. And while it may be true that fortunately, and thank God, the death rates are not as consistent as they are with other vulnerable populations in our adult population, we still are learning every day about the ramifications of this virus and the long-term ramifications of this virus on those that are infected. And as a parent of 3 kids who cannot get vaccinated, but the moment that they can will, I think it's fundamentally important for us to invoke what we know works, and we know that masks work. Fortunately, in our region, I've had the opportunity to travel a little bit, not a lot, but a little bit in the last 6 months. And anecdotally, many more of our residents continue to wear masks here in our community than in other parts of the country. It's just become a normal way of life. It's common sense for us to protect not just ourselves, but those around us. And so that's good news. I appreciate the thoughtful amendments that have been put forward by my colleague, Councilmember Friedson. I am generally in support of them. I know we will discuss those specifically, but we do want to make sure that while we are adhering to the guidance and invoking this important order and step forward, that we also take into account the lessons learned and the disproportionate impact on some members of our community. And so I'll just note also that we will go deeper if we have to. And I think it makes sense for us to establish specific and clear benchmarks and metrics so that people can understand where we are in this process. And while we've made tremendous progress in the vaccination rates, we know that there's still more to do. I'll just close with this thought. I just got back from New York. I was there for 5 days with my family. We wore masks the entire time. I will say most of the city continues to wear masks just as we are here, and they are pushing ahead with other requirements that we're going to need to take a look at some point if things continue the road that they are down now. And I said final thing, but this truly is the final thing. We know in the past that, right now we're seeing a bump, but there's also a rhythm to this based on our weather. And so as things get colder, I think it's wise for us to enact proactively measures such as this, because they will hopefully prevent us from having to enact more severe measures later on. So I appreciate all the continued work and the partnership with the executive branch and Dr. Gales. I wish we didn't have to be here today, but I think we have to continue to remain vigilant as we work through all of this together.
Thank you, Councilmember Reamer.
Thank you. Well, I certainly support the proposed regulation, and wearing masks indoors is almost always a very cost-less way to combat this pandemic. And I know that there are certain situations where it could be challenging, or there are certain people for whom it is challenging, and we need to have some flexibility in our policy as we do with the exceptions. But as this case count is rising, I think it makes sense for us to return to indoor mask usage tied to case counts and the level of transmission. I also just wanted to say that for the potential of additional social distancing requirements, ones that have a much more significant impact, I think that case counts is probably not the correct metric for us to use, and that we should be looking, as we discussed last time with Dr. Gales and Dr. Stoddard, at hospitalization. I think that we know that because we are highly vaccinated, and for the most part, people who are vaccinated don't experience serious illness, we have to rethink what the case count means. I think that case count is satisfactory for an indoor masking requirement, again, because I think it has a limited impact and limited social impact in a negative way on businesses. At the same time, it has a very strong impact positively on the transmission of the virus. But I just wanted to say that today, as we take this up, We need to request regular information about hospitalization rates and new admissions to hospitals. That information is available in our old dashboard, but I don't believe it's on the website now. And I did look at it, and the good news is the number of new hospital admissions is a tiny fraction of what it has been at every point of the pandemic in the past. That was a bad point of the pandemic. And if you look at the spring, you look at the fall, you look at the winter, new hospital admissions were much higher than they are now. So the good news is the vaccinations are working, and new hospital admissions are relatively low compared to where they've been throughout the pandemic. But we ought to keep our eye on that and use that as one of our key metrics going forward. And again, I think that the level of new hospital admissions that we have now would not support more significant measures. And I want to dispel any notion that the level of cases that we have now would justify school closures. They would not. Absolutely not. Other kinds of major social distancing measures that have huge impacts on our community, I do not think are justified according to our current level of cases, and then more importantly, hospital admissions. So let's just keep our eyes on that as well as we proceed. But I do think it makes sense for us to wear masks indoors in public settings now. Thank you.
Thank you. Colleagues, Dr. Gales is with us, and I'm told he has to leave at 3. So if anybody has questions for him, you might want to indicate that. Dr. Gales, I have one quick, I don't know if you want to comment on Councilmember Reamer's comments about the importance of case counts versus, or not versus, but hospital admissions as important metrics. And if so, then I'll have a quick question for you afterwards.
Sure. Can you hear me okay?
Yes.
Sure. Good afternoon, everybody, and thank you for the opportunity to speak with you all. We just want to clarify a couple things. So the transmission levels that we are using as a metric for this are consistent with the transmission metrics put forward by the CDC on last week, and consistent with the same metrics that the District of Columbia and a host of other jurisdictions have used to put this forward. So the definition of substantial transmission and high transmission, we have not created any of our own in Montgomery County. We're using what has basically been a national definition. And according to that definition, we actually have reached the substantial transmission category today. Right. And to Councilmember Reamer's point, we've been very clear in our previous conversations and our briefings to note that we are not just looking at the community, the case rates, if you will, because we do have a new variable that is different now than where we were last year, and that variable is the percentage of our population vaccinated. So we certainly will continue to look at the hospitalization rate. As you all get in your daily report that I send out with the numbers, I do break that down in terms of the number of new hospitalizations, as well as if there's been any change in our COVID-related fatality rate. And we have communicated your desire, Councilmember Reamer, to update the new dashboard with that link or inclusion of that information that was on the old dashboard. I do believe that the IT team is working on that. So rest assured, folks at home, again, this is an effort to prevent us from getting to the point where we start to see hospitalizations increase, certainly, hopefully nowhere close to what we're seeing in other parts of the country. And we don't want to wait for that number to get to a significant point before we take a certain level of action. And hopefully, by putting forward this measure, this would prevent any conversation about closures, capacity limits, those kinds of things.
Thank you. That's what I was hoping you would clarify too. I think it was said earlier that we weren't yet at substantial, but according to CDC, we are. So if passed, this regulation would take effect immediately. I know when drafted, we were hoping to give people some predictability, but it would take effect immediately, unfortunately, right? Because of the rising.
Well, I would defer to our legal team on that one. I think, I would, given that, there's some notice needed and so forth, I believe we put forward language for it to go into effect tomorrow night at midnight, I believe.
Okay. Ms. Kinch?
Yes, I was just going to mirror that. Given the notice provision that's in the Board of Health reg, we will be sending a notice to you after this hearing indicating that we're looking at starting the mask mandate at 12:01 on the 7th.
Okay, great. I'd received that question. Thank you for clarifying. All right, Councilmember Jawanda.
Thank you. Thank you for the work as always, Dr. Gales. If you could stick with me for 1 second, I have a question for you. I will be supporting this. I think it's an important measure. As we mentioned, we are mirroring the CDC's guidance on what constitutes substantial transmission. Just wanted to point out that in addition to the fact that we've done a great job vaccinating, there's also another variable, which is the Delta variant, right? And that it is, according to Dr. Fauci, I think I read or heard him say the other day, much more transmissible if it breaks, in vaccinated people, if there is a breakthrough infection, it's about 1,000 times higher, is what I think you said, that someone could pass that on as far as the caseload within the Alpha variant, the first thing that we were dealing with early on. And so that's a different case. So I wanted to allow you, Dr. Gales, to talk about that. In this, as I see this, we're protecting the unvaccinated, but we're also protecting, I have 4 children under 12. We're protecting all the children that are unvaccinated, but we're also protecting, realizing that if there are breakthrough infections, which again, when you get vaccinated, much more less likely to get sick or be hospitalized, which is why you need to get vaccinated. But if a breakthrough infection does occur, that can be passed on to other people. So I just want to, if you could speak to that, and then I have one more question. So maybe I'll let you speak to that first.
Thank you, Councilmember. So you're right. This is a different variant compared to what we were dealing with earlier last year in the pandemic. And so there are some unknowns. The certainties, as you've laid out, and you quoted Dr. Fauci, are that it is there's increased level of transmission for those who are unvaccinated. And there's still a risk of transmission for those who are fully vaccinated and passing it from person to person. We do know or suspect that particularly for those who are unvaccinated, if they contract the Delta variant, they are at increased risk of having a worse symptom course and at increased risk of ending up in the hospital compared to the novel strain of COVID-19 that we were fighting and dealing with mostly last year in the earlier part of the pandemic. So it isn't exactly an apples to apples comparison. We are dealing with a much more potent strain of the virus. And you're right. So we have to not only protect those who are unvaccinated, and hopefully they get vaccinated because they are at increased risk of having worse outcomes, but we do have to make sure that we protect those populations who aren't eligible, including our children. And one thing I want to clarify is that, lots of folks say, well, children don't get sick and young people don't get sick and they are asymptomatic. Those are not guarantees. And even an individual who is an older, more robust, healthier person, it's not a guarantee that they will have a completely innocent core illness if they contract it, particularly as we learn more about the potential long-term side effects of COVID-19. So we don't just dismiss it and say, well, if children get it, they'll be fine. We have seen increased pediatric cases across the country, particularly in Arkansas, Texas, and Florida, where children are having complications and they are ending up into the intensive care. So this isn't completely nebulous or harmless, and that's hence the increased and heightened level of protection that we have in place for our children.
I appreciate that. And the other question going along with that is, as I said weeks ago, and many of us, I've been wearing the masks indoors when I'm not in a space by myself or with close family. Because of the potency of the Delta variant, I have also read, and I wanted to allow you to speak to this, about the type of mask, right, that would be worn. Obviously any mask or face covering is better than nothing. We went through this early on. But is there anything that you can suggest as far as, I had read something about that you should, if you had a surgical mask, have a cloth mask on top of it, or have an N95, that now there's more of those available. Anything about the level or quality of the mask? I just wanted to allow you to say anything on that if you wanted to, Dr. Gibbs.
Thank you. That's a great observation. I don't have any recommendations per se outside of what we have generally been, putting forward and recommending to folks. I think it's also important for folks to continue to understand that, particularly in crowded spaces, it's still a good idea to minimize your exposure and proximity of contact with folks outside of your household, and continue to wash your hands and those kinds of things. As a comprehensive toolkit, if you will, to minimize your risk of contracting it and potentially transmitting it to other folks. Certainly, I wear a surgical mask most of the time when I'm in indoor spaces of close contact or in spaces where I'm required to wear one. And I feel comfortable wearing that as a level of protection, when I'm out around other folks.
Thank you. Thank you very much. Thank you, Mr. President.
Thank you, Councilmember. Dr. Gales, I'm glad you mentioned the vulnerability of children. My kids got sick when they got COVID. My neighbors and friends' kids got sick. Nobody should take for granted that they're invulnerable. Councilmember Glass.
Thank you very much, Mr. President. And I just quite frankly want to start by saying how proud I am of so many of our residents here in Montgomery County. 71% of whom are fully vaccinated. And that is one of the best rates in the country. And it shows that we are a community that respects science and, more importantly, respects each other, because we don't want our neighbors and friends and coworkers getting sick. And while I'm proud of the overwhelming majority of our residents, I got to express some frustration with those who still haven't gotten vaccinated, because not only are they putting themselves at risk, but worse, they're putting others at risk, especially our children. And just yesterday, I was in the District of Columbia with family that's visiting, and there are two young kids, two young cousins of mine, and their parents, and we were out and about, and we were all wearing masks routinely, because not only for the young kids is it the right thing to do, but DC now has an indoor mask mandate. And so just yesterday, we went out, we went shopping, we ate out, we rode the metro, we visited the Smithsonian's, and it was a wonderful day. And for almost the majority of that, aside from when we were walking around on the street, we were all masked. And from the beginning, we have taken a regional approach to making sure that everybody was healthy and safe. And as the District of Columbia and so many other jurisdictions around our region are taking this simple step to provide for more public health by requiring masks in indoor public spaces, I think we should follow suit to make sure that as people continue traveling around the region, we limit the travel of COVID-19 and the Delta variant. And I appreciate the amendments that will be put forth during this conversation as a way to show folks, the path forward. And I appreciate Councilmember Friedson for the amendments that he will be introducing. But this is a simple step just to ensure that we are all healthy and safe. And for those reasons, I will support this and look forward to the ensuing conversation about ways to strengthen this common sense approach. Thank you, Mr. President.
Thank you. Well said. Just earlier this afternoon, the City of Baltimore instituted an indoor mask requirement for all. Councilmember Novato.
Thank you, Mr. President, and it's good to see you, Dr. Gales. I do want to first definitely acknowledge and thank our residents. Obviously, we are at a very different place right now, having had the experience of these 15 months or so of just a roller coaster. Our residents really stepped up, and that is super commendable. I'm sorry that we're back here again. I know that this is extraordinarily frustrating for everyone who has stepped up and done what they had to do, including, as it has been observed, continuing to wear masks. And I do believe, and I associate myself with the comments that unfortunately we're not an island. And unfortunately, the fact is that we are part of this metropolitan region, and it is a region that is, very popular. And so we have people coming from all over the country. It is important to know that there are areas of the country that continue to believe this big lie that COVID is a joke. And that has, unfortunately, I think, of course, affected us. And so for me, it's all about being proactive. That's what we've done here. And I think that is why we haven't seen the devastating number of deaths that at first we were so worried about, because we are proactive and because we work together. So this is one more step in recognizing that we are not completely done. You know, I've also read the reports of now in South Korea, a Delta Plus variant apparently that has been identified. It is absolutely, of course, a concern. But I know that we can get through this. And even though in some ways this, you know, this is, I have to say, you know, fatigue does set in. I understand that. And it can be seen or perceived as a step back. We have got to be hopeful, and we have got to also think about those who are not eligible to be vaccinated yet, and not just do this for ourselves, but do it for our community. So again, kudos to our residents because they've always acted in that spirit. And, you know, I will be supporting this. I also thank Councilmember Fritza for the amendments that are coming forth. But I believe that if we continue to work together, we're going to be able to get ourselves into a good place. In closing, I'll say, you know, one of the things that has been so extraordinary complex about this pandemic is that it's not just one-dimensional in nature in terms of its impact. It's not just about our health. It's not just about those that we have lost. It's about all the economic impacts. It is about really shifting, you know, a complete paradigm. And I get that it is frustrating, but we're in this together, and we have to work collaboratively. There is no other way to get through this. So anyway, thanks for all of you who have worked so hard, and for folks who, I think there's some confusion out there as to who is the Board of Health. It is the council. Obviously, no, we're not public health experts, but we do have extraordinary experts who inform us and help us make these decisions on behalf of our residents. So again, appreciate the team and appreciate my colleagues.
Thank you. Councilmember Katz.
Thank you very much, Mr. President. And I too want to associate myself with what my colleagues have said. And I certainly want to start off and thank Dr. Gales and Dr. Stoddard and the public for all that they're doing. We are in a better place because of everything that each one of them has done. And I too will be supporting the resolution. And I want to thank Councilmember Friedson for his well thought out amendments. I think they all make sense, and we're certainly going to get to them, I guess, one by one, but they do make sense and are certainly something that we should be certainly working on. I also want to make note about what the Vice President talked about the colder months. You know, we are, and I agree with what he's saying, and we saw last year for the crisis we were going through that the flu, and the doctors can correct me on this, but the flu was way down because people were wearing masks. And so that's another positive step that wearing masks will be doing for us if this passes, which I believe it will. And I just wanted to be known that I was just a few minutes ago in a restaurant, and the restaurant on their own had a sign up that said you had to wear a mask. And it was crowded. I mean, they certainly had distancing and everything, but they were doing business, and which is very necessary for all of us. They were doing business, and I heard one person say to somebody he was with, "I didn't realize Montgomery County had required that yet." Well, and he wasn't talking to me, and I figured that there's no need for me to, jump up and say that we're going to meet in a couple hours, and maybe this will become a requirement. But the reality is that there are businesses that are doing this. The reality is this will help those businesses because they won't be the only ones. Every now and then you hear of a person getting angry at that business because they were forced to put on a mask where it wasn't a requirement. This is not only is it proactive, this is actually will be a prevention for everyone associated with it. So I thank everyone, and I will be supporting it as I will with the amendments. Thank you, Mr. President. I will turn it back to you.
Thank you. Councilmember Navarro, do you want to ask your question, or should I ask?
Yeah, I apologize. I forgot. Can you restate again for the public when it's going to become effective, and then also the various ways in which we will be communicating? Obviously, not only this effective date, but then, if and when it would be lifted, how would that happen? Because I'm sure, just as Councilmember Katz just stated, there's plenty of confusion as to, when is this effective? I thought we were still, we were doing this all along. So it's going to be super important how we use our communication tools to get this through. So can you, again, restate when it comes effective, and then what is the plan for communication, constant communication, updating the public?
I'm not sure if that's directed to Dr. Gales or me. I can tell you the notice provision because I can see he's looking. The notice provision is as follows. We will be notifying the public via a press release as well as our usual channels of communication, Twitter, social media, posting on the county's webpage. And we'll also be notifying the local municipalities and provide them with a copy of the notice. The anticipated start date is August the 7th at 12:01 a.m. So I believe that is, sorry, I have the wrong calendar up. Saturday, right after midnight is when we were anticipating it would start.
Mr. Hartman?
If I can add to that, we will engage our entire communications apparatus, Councilmember Navarro, including the community engagement cluster, the regional service directors, the community partnerships, our multicultural outreach team. We know we need to get this into every corner of the county, as well as through our business team here in the county exec's office.
Thank you. I appreciate that. And I don't know if it's also possible for us to use the Alert Montgomery system. I think that, it's something that is used quite well as well. Thank you.
Out to you. Councilmember Wright.
Yeah, sorry.
Yeah, I'm just going to be very brief. I agree with everything my colleagues have said, and especially what Dr. Gale said in highlighting, because we did hear during the public hearing that, well, none of the stuff that we've done has worked, and so therefore it's futile for us to actually engage in, reinstating this mask mandate. The reality is that the reason why our numbers are so low is because we've been instituting a lot of the practices that were recommended by our public health officials. And so, look, I understand that it's frustrating. I understand that it's not where any of us want to be. But in order to continue having the success that we have had, we need to make sure that we do this. And so that is what this is all about. I understand that folks feel as though they're somehow being penalized by those who don't wear their mask. Well, the reality is that the majority of laws are based on the people who are doing something wrong, not the people who are doing it right. And we have to protect the public because we understand that some folks just aren't doing what they need to be doing. The same thing applies here. And so, we need to make sure that we're protecting the public and protecting the best interests of everyone, understanding that not everyone has chosen to get vaccinated. And we know that even with the vaccinations, that there still will be some challenges. I mean, very minute, but still ones that we need to recognize. And so I think that it's important for us, again, to be on the safe side as we've always been, and we've seen that we've benefited because of it. So I really appreciate all of the Dr. Gales, our HHS department as a whole, and all of our partners, whether it's through Office of Emergency Management and Homeland Security and the like, have all done to continue to keep us safe.
Councilmember Rice.
Back to you, Mr. President. That was it.
I think we lost the last part of your comment. If you want to repeat it, please.
Oh, I'm sorry. So, sorry, the connection here is not that great. But let me just say that, again, I just really appreciate everything that Dr. Gales and Dr. Stoddard, the whole HHS team, as well as the Office of Emergency Management and Homeland Security have done to keep us safe. It really is important. We've been following the lead from their guidance. And certainly have benefited as a result. And I know we'll continue to do that by instituting this mandate and continuing to do what they're recommending. That's why we've been in the best place so far, and that's why I know we'll continue to be there.
Okay, thank you. I don't see any other requests to speak on the proposed regulation. Councilmember Friedson, do you want to comment and discuss your amendment?
Thank you, Council President. First off, just want to thank colleagues for all of your work and efforts on this. Thank you, Council President and Council Vice President. Thank the executive branch and Ken Hartman, Bob Drummer, Sylvia Kinch, and Christine Wellens, and of course, Dr. Gales, Dr. Stoddard, Dr. Bridgers, the whole public health team. A lot of work has gone into this regulation. A lot of efforts have gone into some of these amendments, which keep what the intentions were, but try to adjust and adapt to some questions and clarifications that were needed. Also want to thank our labor partners, who I know the executive branch has been working with to try to address some of these issues as well related to our county workforce, and the idea that we had talked about previously of the county really leading by the power of our example, just as much as the, if not more than the example of our power. Just noting what colleagues have said, we have said from the beginning and all along this pandemic that we would follow CDC guidelines, public health guidance, and try as best as we could to take a regional approach. And I think today we're trying to do that, to adjust to where things are. I appreciate the work in making some adjustments here. And so if it is okay, I'd like to go through the amendments one by one. And then I had one, after we get through the 4 amendments, just one question clarification as well, if that's okay with you, Council President.
That sounds great.
Thank you. Okay. First Amendment, this is really straightforward. It's just about the daily posting of the metrics pursuant to this guideline. I know it's the intention and expectation that the executive branch will be doing this, intends to do this, but this is making sure that we codify and memorialize that. We can have staff read it if you like into the record, or how do we want to handle that? Okay.
Ms. Wellens, you want to describe the amendment?
Mr. President, I was just going to, I'm happy to. I was also going to suggest, if I may share my screen, I could post it for everyone to look at at the same time.
Please do.
Okay, I will attempt to do that. Are you able to see the screen, Mr. President?
We are.
Okay. Scroll down so you can see the full text of it. As Councilmember Reamer described, this is adding a daily posting. I'm sorry. As Councilmember Friedson described, this will add a requirement to make sure that we're sharing robust information with the public, at least daily, on the CDC metrics. So I'll just read it into the record at least once daily. Excuse me. At least once daily, the health officer or his designee must update the county website with the county's current community transmission status, including information on the total new cases per 100,000 persons in the past 7 days and the test positivity percentage during the past 7 days. And of course, that those metrics link to when the community transmission status, according to the CDC definitions, changes.
Thank you. With that, I'd like to move that amendment.
Second that, and I have a comment.
Councilmember Friedson moves. Councilmember Reamer seconds. Quick question. Will that also, I know it's not spelled out here, but is that likely to include hospitalization data? I know there's been have been questions about that, and people have had to go to the state website to access that. Ms. Wellens? Ms. Kinch?
Yes, we will be adding the hospital data back onto the webpage, so that should be available and people won't need to go to the state to find that data.
Great. That will be well received, I think. Councilmember Reamer.
Thank you. That was going to be my comment. I think it's important that we not begin to set the expectation that daily cases are the essential metric as they were for us, I think, in many ways to help explain the pandemic. I think we are going to have we're going to have additional metrics that are going to be crucial for us, but this particular proposed order is tied to the transmission and the case data. It's not tied to, hospitalization or other measures. So as Dr. Gales said, that they are, and I had discussed with Dr. Gales, that they are looking at posting other data, and hospitalization will be among that. And, I think we'll want to all see those other data sets as well. And again, this is tied to this particular order, so it makes sense that it's focused on transmission, but we broadly want a new dashboard once again with a variety of statistics.
Right. Okay. So the amendment has been moved and seconded. All those in favor, please raise your hand.
Aye.
Councilmember Rice as well. That is unanimous. Thank you.
Thank you, Council President. The Second Amendment is related to the termination clause. You heard public testimony about this. We heard colleagues mention this. This simply would specifically clarify that this new face covering requirement indoors would go to effect based on us entering substantial transmission per CDC guidelines. And just like we're using a data-driven, clear public health guided metric to establish this requirement, or frankly, reestablish this requirement, we would have a clear data-driven public health guided metric in order to end it. And it would be the same metric if we go into substantial transmission, which, as you heard, is expected and imminent. When we come out of substantial transmission per CDC guidance, there would no longer be an indoor mask mandate in effect. So I'll turn to staff to read it into the record, and then I'll move it.
Thank you, Councilmember Friedson. So the amendment is first to add the definition for moderate transmission, and which is consistent with the CDC definition and simply reads moderate transmission means 10 to 49.99 total new cases per 100,000 persons in the past 7 days, or 5 to 7.99% test positivity during the past 7 days. And then the amendment would go on to adding a new subparagraph at line 44, reading the requirement to wear face coverings under subparagraph A terminates without further action by the Board of Health when the county returns to a status of moderate transmission.
I'll move that.
Second. Councilmember Friedson moves. Councilmember Rice seconds. Councilmember Reamer.
Thank you. I have some concerns here because what Dr. Stouter described as the yo-yo issue, I wanted to have the sponsor wanted to grapple with that issue, that it's certainly imaginable that we could be at a time where we move in and out based on a 7-day average of transmission levels by a very small amount. And then we would have, a mask requirement that is on one day and then off the next and then maybe back on. So I'd like to hear from the sponsor about that, but I think that is a concern. I wonder if there isn't some approach here that achieves the objective without, having that problem.
I appreciate the question. I think realistically, I don't think the community and businesses are able to respond on a day-to-day basis once we move into this, and it's based on a metric. We should follow the metric, and I think that the expectation is there. The way it was originally drafted, we would have to meet to eliminate the requirement. So once we go into this based on substantial transmission per CDC guidelines, the public health officer would have to inform us that we're no longer in that substantial rates. Then we'd have to schedule a meeting, then we'd have to public notice it, then we'd have to reconvene, then we would have to vote to eliminate it. It didn't seem reasonable in terms of public expectations and the intent to follow the public health guidance and follow the CDC guidelines. The challenge of doing it in another way is that you would have to then have a substantial amount of time after we were no longer in substantial transmission in order to remove it. And you still could have the possibility where we would move out of it and have to move
Maybe
back in it. So
could I suggest that it be 14 days for the return? That way you would probably really work out some of that noise. So it's
the challenge. I mean, that there are some who've suggested that, and that would be similar to how the evictions, for instance, work, which are different standard from this per the CDC guidelines. The challenge with that is you would have the same issue that ultimately you could go out, you set the 14-day clock, then you go back in, you set the 14-day clock. I mean, if you're basing a standard based on the CDC guidelines for submission, for substantial transmission, then no matter what, you're going to have a potential issue. You can, adjust it to try to mitigate that to a certain extent, but ultimately that will always exist. The question here is, at what point would the council, the Board of Health, have this in place, and would the county be enforcing this realistically, understanding the fact, as it has been the case throughout, that the county can't necessarily be everywhere and enforce this in every place. The purpose is, when we're at substantial transmission, that you are wearing a face covering indoors, and that is the standard that we're setting. So I wouldn't be supportive of the 14-day standard. I think this sets the same standard to go in as it does to come out, which I think is appropriate. So that, I appreciate the thought process, but that's the rationale behind this. I don't think there's any perfect solution to this, but I think we should have a similar standard of creating this requirement as we do to remove this requirement.
all right. Well, I don't really agree. I think a 14-day requirement to come out would be fine. Doesn't have to be symmetrical, and that would, going in is already, we're already there. So what's the harm in a 14-day requirement, which would smooth it out and avoid further? I mean, you have a 7-day requirement, that's good. That smooths it out already.
It's not a 7-day requirement, just to be clear. It's the 7-day
average.
Right,
that's what I'm suggesting.
Which is what the metric is based off of. What you're suggesting is that we then have 14 consecutive days of having a rolling average of 7 days. I think that's very confusing for the public to understand. I think it's much clearer to say, when the CDC has us in substantial risk per their guidelines, there's an indoor mask date. When the CDC no longer says that we are at substantial
The issue
risk,
is you're putting an automatic trigger in. So the mask order could be out one day, and then the next day it will no longer be.
The alternative approach is how this was written previously, which is to say that the Board of Health could reconvene and could vote to remove it. I'm not supportive of that. I think that it, we should have clear understanding that's data, metric, and public health guideline based in order to move out of it. But up to the will of the body where we end up on that.
See what colleagues have to say.
Okay, Councilmember Jawanda.
Thank you. I think I was going to raise a similar issue to Councilmember Reamer. When we did this last time, we removed the mask. When we had the standard that we set, it was 2 weeks after that date that it kicked in. I am also concerned about the yo-yo effect. I like yo-yos, but not in this instance. I think you want to set a standard, and you could say that you have to be in moderate transmission for X number of days. I think it's open of what X is before the trigger kicks in.
Can I make a clarification, then a suggestion to address that? I would suggest 3 straight days of moderate transmission or below. Then it would ensure that you're not going in one day, out the other day, in one day. If we're teetering on the line, that's not where this is headed. I will point out this has headed straight up. We hope that eventually it will head straight down. It is possible that dynamic would change. I think if you made it 3 straight days, based on the health officer's notice to us, I think that would be clear. I don't think that residents are going to be capable of following this on a day-to-day basis. I mean, I think that is totally unreasonable. I do think the yo-yo effect, I get the point, and I think if we did 3 straight days, I would be comfortable with that. I think that would help to address that, and I would personally accept that as a friendly amendment. We'll see what the second believes on that. I would just point out a clarification, and I know I just want to clarify. The 2 weeks that we did for the vaccines were because you're not fully vaccinated under the CDC guidelines until you're 2 weeks out from your second dose or your first dose of the J&J. So I'm not arguing. I just want to clarify. It was a little bit of a different dynamic for that. I will note that we are not easing into this restriction now. We had intended to do that. We were putting this in place immediately. I think we need to have a very clear understanding of when we would come out of this. So I think if it's 3 straight days to avoid that yo-yo effect of entering moderate transmission or below, I think that would be appropriate. I'd accept that as a friendly amendment if the second.
Same here. Same here.
I appreciate it. I was going to say a week, but I would like some, 3 days, 7 days, whatever it is. I would like, if Dr. Stoddard's here, if there's some guidance. I just think there should be a defined number of days it stays below before if you have a trigger. So if it's 3 days, that maybe that's not enough. I was going to suggest 7, but which is less than 2 weeks. But are any of our public health officials on to give any guidance to what might make sense?
I don't think they are, Mr. Hartman.
So we had a conversation with the county executive, and we are comfortable with the 14-day standard, which is in line with the CDC guidance on when the evictions moratorium comes off. I think there's a good parallel with that, and that's where we are at the moment.
All right. Well, in light of that, I'll go back to my 7-day suggestion then. And, I don't know, it's the sponsors, but I think there should be a defined period. I think 7 is reasonable. It allows enough time for it to be clearly trending down, and it's not an aberration. You're probably right, Councilman Friesen. It is unfortunately going up right now. We want it to go back down. But if we have an automatic trigger, I think we want to know that it's going down. So, I would suggest
in the interest of consensus, I would accept 7 days. I want to move forward here. I just think we need a very clear standard. I would note that evictions are also quite different from what we're talking about here. And we've had, unfortunately, a lot of conversations at this body about how evictions and the disruption that it creates and the challenges, is a different dynamic from what we're talking about. I'm comfortable landing on 7 in the interest of bringing everybody together and moving forward in a unified fashion. And I believe the second is also an agreement. He just texted me. So.
Okay, great. Wonderful.
I agree.
All right, we'll accept those as friendly amendments, and I will move the amended amendment forward with a 7 consecutive days in moderate transmission or below.
Great. All those in favor of the amended amendment, please raise your hand.
Aye.
That is Councilmember Rice.
Aye.
Great. That's unanimous. Councilmember Friesen.
Thank you. Third amendment. This is an exception for public speakers and performers, assuming that they are a minimum of 6 feet away from areas that are open to the public, which would include an audience. For instance, this could also include, for instance, a faith leader. Those who are in the crowd would have to be masked, but those who are speaking from the pulpit, for instance, would not have to be masked as long as they were appropriately socially distanced. I will note that this follows a similar standard in DC, which we are trying to take that regional approach. It also ensures that our arts organizations that are just starting to reopen would effectively be shut down by this standard. This would help to address that issue, which was certainly not the intention of this Board of Health regulation. So I'll ask staff to read it into the record.
Thank you, Councilmember Friesen. As you can hopefully see through the shared screen, this amendment would amend paragraph 2B of the resolution to add under subparagraph B a new exception. And the exception would be for when a person is giving a speech or performing for broadcast or an audience, if no one in a location accessible to the public is within 6 feet of the speaker.
Thank you. I will move that amendment.
Second.
Councilmember Friesen moves, Councilmember Reamer seconds. Any discussion?
Just want to say thanks to Councilmember Friesen for crafting this amendment. I think it's really important.
Right. Agreed. All those in favor, please raise your hand.
Aye.
That is unanimous. Great. Councilmember Friesen.
Thank you. Last amendment sent around to colleagues. This is the employee vaccination requirement. I've talked before, I'll say again, I think it's important that the county lead by the power of our example, and I think this is a good example of it. I really do want to thank Ken Hartman and all of his work, and along with the executive branch on this, thank our labor partners. We received a memo from the county executive that the executive branch and the county executive has reached an agreement in principle with all of our employee unions in order to implement a vaccine requirement for county employees. There are some details that still need to be worked out, which I believe will be. What this amendment does is it memorializes what the county executive has shared with us in his memo, that the agreement had been worked out, that specific detail to submit an implementation plan and schedule for the employee vaccination requirement would be sent to us on or before August 20th, and that reporting of aggregate testing and vaccination status, the plan would be submitted to us on August 20th, and then ultimately there would be a requirement to report on the aggregate testing and vaccination status by August 31st, and every week thereafter. The executive branch has shared with us that they believe that this is certainly doable. They're moving in that direction, and this will clearly set that expectation for the public. Hopefully it will help to inspire more private sector employers that we hope to move in a similar direction as well, and also just memorializes what the executive and council have been working towards and working on with the labor partners. So I'll ask staff to read that into the record.
Thank you, Councilmember Friesen. The amendment first would add several findings related to, first, the efficacy of vaccines, and second, related to the fact that, according to the CDC, there's a growing body of evidence indicating that vaccinated persons are less likely, that vaccinated persons are less likely to transmit the SARS-CoV vaccine to others, but that they still can spread COVID to others. The third finding relates to the number of county employees, that we have over 10,000 employees, and that there is an expectation, both from an employee safety perspective and also from the public's perspective in interacting with county employees, that they should be able to do so safely. There are a couple of definitions would be added. County employee would be defined as an individual employed by the county, regardless of the individual's merit system status or representation by an employee organization. COVID-19 test would mean a diagnostic test authorized by the Food and Drug Administration to detect whether an individual has SARS-CoV-2 infection. Fully vaccinated would mean 14 days after having received a full dose of a COVID-19 vaccine authorized by the FDA, including the Pfizer, Moderna, or Johnson & Johnson vaccines. And then the substantive part of this amendment is that there would be a new paragraph added, paragraph 4, to provide that on or before August 20th, 2021, the county executive must report to the Board of Health regarding an implementation plan and schedule to require each county employee who reports to work at a county facility to provide to the county on a weekly basis proof of a negative COVID-19 test or a test to the county that the employee is fully vaccinated against COVID-19. The executive also would have to report by August 20th a method by which aggregate data on county employee vaccination and county employee COVID-19 testing will be made available to the public. Second, there would be a subparagraph B that on or before August 31st, 2021, and weekly thereafter, the county executive must report to the Board of Health and must make available to the public aggregate data on county employee vaccination and county employee COVID-19 testing. Thank you.
I'll move that amendment.
Is there a second?
Second.
Councilmember Friesen moves, Councilmember Novato seconds. Any discussion? Councilmember Reamer.
I'm glad we're doing this. I'm unclear whether I was concerned by some of the comments I read by the FOP, and I hope that in the beat today, I hope that it's unclear to me whether the memo that we got from the executive branch reflects what the FOP's position is. So I hope there's a good solution here soon, and I think it's really, really important. I also wanted to commend this to the Board of Education. I think if it's within their power to do this for school employees, I think that would be very helpful to protect our school employees from those colleagues of theirs who may be unwilling to get vaccinated, and to protect our children from adults who are unwilling to get vaccinated. And that's what we're trying to do here. We're trying to protect our county employees and the people they serve. It's really important.
Okay, I don't see any other requests to speak. I'll just, I want to thank you, Councilmember Friesen, for pushing this ahead, and all of my colleagues. I think it's great that we, accelerated the discussions between our employee organizations and the executive branch. At other times during this pandemic and over the last year, we've had to sort of, as a council, step in and, to my view, do the role of the executive branch, like ending hazard pay and reaching an accommodation there. In this case, I think these discussions are totally appropriate. It would have been great potentially if they happened sooner, but it's great that they're happening. And I've spoken to the executive branch and some of the employee leadership, and they feel like they're productive and they're going to be wrapped up very soon. I know they're meeting Monday morning. So I think it's great that we played a role in accelerating this. Thank you, Councilmember Friesen, for pushing that ahead. And I'm glad that the employee organizations that I've reached are supportive of this amendment to continue to sort of codify where we are now and continue the acceleration. So thank you. There's, and as I've looked into this, there, like anything in a $6 billion operation, there are a lot of details and a lot of complications. We have a lot of workplaces that are close to the public that would not be subject to this mask mandate. All of our firehouses, all of our police stations, many other county offices in the back office, and the protocols there have been in place all year. I think it's great to give them a little bit of time to work out some of the details amicably. So anyway, that's all I have to add. Any other comments? Okay. All those in favor of this amendment, please raise your hand.
Aye.
That is unanimous.
Thank you, councilors. I just had one last clarification. First of all, thank you to colleagues for the feedback and the collaboration and coordination. I think we have moved in a positive direction here. We're sending the right message to our residents, who we still need to rely on to help to get us through this challenging environment. We can only do so much, and it's ultimately up to our residents and businesses that they have throughout this entire pandemic, I will note, to make sure that Montgomery County really is a leader nationally. That's not because of county government, that's because of county residents. And I hope that will continue, and I hope that this helps to move us in a positive direction. I just want to note one thing, based on the new information that we received during this hearing, that we have moved into substantial transmission, which is not what we had originally anticipated. I think it is a little bit confusing on line 65. The effective date is August 6th at 12:01, and then we just heard from Ms. Kinch that the expectation is to require this on August 7th at 12:01. And so if it doesn't cause any issues, I think it would be clear if we just made this go into effect and amended line 65 to August 7th at 12:01, so that the date we intend to mandate this and the date that is effective in the order would be the same. I would imagine that any of the notice requirements could happen beforehand, as you are intending. Anyway, I just think having two dates that are one day apart is awfully confusing to communicate to residents. So I just wanted to put that out there. I apologize for not knowing that we had already reached this point going in. We were working on the amendments, and I didn't look at the latest data. So I just maybe could turn to Ms. Kinch and see if that would cause any legal issues.
So my only concern would be that Dr. Gales's authority to sort of set the start date of the mandate arises from this particular Board of Health regulation going into effect. And so if it goes into effect on the 7th at 12:01, he doesn't really have the authority to say, to provide the notice and to say, well, the mask mandate goes into effect at the exact same time as he gets the power. So that notice provision is, again, I think we all thought we had a little more time before substantial transmission. It made a lot of sense then, but it's a little complicated now because it's all overlapping.
Is this getting too cute? But if we make it in effect at midnight on August 7th, he would have the authority for 1 minute to go and, to implement, and you could start all the messaging and everything, but at least the dates would be the same. At 12:01, it could go into effect.
I mean, that would meet the letter of the law, with the understanding that the notice provisions would start going out shortly after this hearing.
Yeah, well, nothing says that he couldn't do the notices before.
That is correct.
The technical authority would be 1 minute before. I would move that. I think it's much less confusing if it's midnight and 12:01 on August 7th. I don't think anybody's going to even notice the difference, but I do think having two different dates swirling around that are 1 day apart is awfully confusing. So I don't feel that strongly about it, but I do think it would be clear for residents. I just wanted to throw that out and have us discuss it. Thanks.
Okay, Councilmember Friesen moves, Councilmember Joando seconds. Any discussion? All those in favor, raise your hand, please. Or indicate. Councilmember Rice.
Aye.
Excellent. That is unanimous.
I'll yield back to you, Council President. Thanks again to colleagues.
No, thank you for all these very thoughtful amendments. We have, I think, a better resolution. Let me bring up here one question that's on my mind. I don't know if anybody else was struck by Mr. Anderson's testimony, and I cautiously raised this as somebody who was probably an original co-sponsor of the statewide smoking ban, and like Dr. Fauci wouldn't recommend anybody smoke, but I don't think any of the intention of this regulation was to completely shut down legal cigar bars, and I don't understand how they could operate, as Mr. Anderson said, if someone is masked. I know there's an exception for in 2B Roman 5 consuming food and beverages, and I wonder what Ms. Wellens and my colleagues would think about including smoking in legally approved indoor. Some cigar bars are one of the illegal exceptions to the indoor smoking ban statewide, and I wonder if it's reasonable to include them here. Councilmember Reamer.
I might draw a distinction here also, though, with hookah bars where individuals share a smoking device, because that's different.
Just a point of clarification there. I'm not advocating one way or the other. I just think it's important that we talk about these things appropriately at a hookah bar. That generally, my understanding is everybody gets a separate mouthpiece, so you're not necessarily sharing the mouth.
Here's what I know.
Yeah. So I based on other people telling me how this works, but anyway, I just for the purposes of discussion, I think it's important that we understand that. So I just wanted to clarify that. Thanks.
I see a meme in production. Okay, anybody else? Any comments on that? Okay.
I think it'd be fun.
I can't move or second an amendment, so
I will move what you've described, but we would use that language.
My only question would be that does that include hookah bars and stuff? I don't want to discriminate unintentionally against any type of already approved cigar or other.
Ms. Wellens?
Yes, thank you, Mr. President. To Councilmember Joando's point, if you'll allow me, I'll share my screen again so we can look at the precise place where we would add this and make sure that the language is inclusive. Okay, so we have at line 30, no, I'm sorry, not line 36, line 35, while consuming food or beverages. So we could add comma, or while smoking at a cigar, comma, smoking, comma, or hookah lounge. I believe that would
Yeah.
Could we
cover
add,
everything.
could I recommend the, sorry, Council President.
Oh, I was just, Ms. Wellens, I don't know if we know all the exceptions in the state law right now. And you might just need to say in approved indoor settings or something like that. Not that I want to tell you how to do your job, but.
Not at all. No, that's fine.
I would just point out these particular establishments were specifically identified and prohibited during COVID through regulations. You could use the same list that was prohibited to note them here. Again, in the interest of consistency, for over a year, we had a listing out of these particular establishments, so we could go back and reference that. I can find it if I have a moment.
Well, I just would say, I mean, I think Council President's point about if it's the exceptions to state law. I mean, Councilman Friesen's list. There were other things I think on that list outside of smoking establishments. So I would think we'd want to, if we did it, we'd want to use the reference to state law probably. Go ahead. Yeah.
You might also try the letter of agreement approach and make sure there's a clause in there that businesses can apply. That would be either an additional measure or a substitute, but generally speaking,
good point.
I don't know what to do with that exactly. I think it probably makes sense for us to have a letter of agreement exception allowable, just in case there's some circumstance we don't understand that our medical advisors would be okay with. But back to this one, I think if we were to say, what has been described sounds fine to me. I might like a stipulation, that there can be no sharing of products or whatever, but if that's not what people do, then I guess it doesn't really matter.
Well, you could require that they maintain social distance.
Well, yeah, and I think that's a good point, because that was the testimony we received, was that the establishment has social distance.
Councilmember Reamer texted me after the testimony, and I think what we had talked about is that perhaps this is a good example of an area where a letter of agreement may be appropriate. This was a mask mandate and not a prohibition of activities, so to speak, and so that wasn't included in here, but perhaps there are other examples that a letter of approval line, as opposed to this, would be a more appropriate way to do it, and would allow for the opportunity for these establishments to explain what was explained, I think, very articulately and thoughtfully during the public testimony.
And there's a very limited number of these types of establishments, so we're, yeah. So that would be, Christine, what would that language be if we wanted to allow for a letter of approval rather than a blanket allowance?
I would suggest that we add an additional Roman numeral, exception, reading that, the exception would apply to individuals while smoking in a facility where smoking is permitted under state law and pursuant to a letter of agreement with the health officer.
Hey guys, this sounds very similar to our waiver process that we had before. Couldn't we just institute that? And doesn't that make it easier?
In other words, not refer to smoking specifically and just say business may. Yeah, that is what I was suggesting. That businesses may apply for a letter of agreement waiver.
Yeah, that waiver process we had before that was always in place, just taking that language and using it.
Glass.
So I appreciate the thoughtfulness and the consistency in which we're trying to apply here, but I have a concern about a waiver process given that we know the timeliness of this issue. And unless there's some assurances and quite frankly, information to all these relevant businesses that there could be quick turnaround, I mean, I think effectively there would be a stoppage of business if the timing in my mind is right. And so I agree with the sentiment that we limit that, or quite frankly, try to get ahead of it. And it might mean working it through a little bit more in this session so that we don't have more hiccups along the way.
Mr. Hartman, do you want to comment on the waiver process, how long it takes?
I'm going to turn to Sylvia. I think we have a concern that a blanket letter of approval process may lead to more than just the smoking lounges and hookah bars. I'll turn it over to Sylvia to talk about the process and the legal questions.
So we obviously prematurely disbanded our letter of approval team, is what we called them, about a month ago. So we would have to bring them back together. Mind you, we did save everything, so it shouldn't be that hard to bring everyone back together. The way the process had worked in the past was anything that was received by, say, Monday afternoon would be considered by a small group Tuesday morning, and then anything that maybe was questionable would go before Dr. Gales and Dr. Stoddard on Wednesday morning. So meaning that the turnaround time is roughly 7 days, calendar days tops. But again, we'd have to ramp that up. It's possible to do it. We would just need to start.
I'll just, if I could, just, I did find the language. Cigar bars, hookah bars, vape shops were specifically singled out to be able to allow for smoking outdoors. So those were three very specific types of businesses. So I just wanted to note that, you know, it could be relatively straightforward if that's the will of the body. So I just wanted to note that.
Why would that be better than a blanket waiver? I mean, why wouldn't that be better than a blanket waiver process involving staff?
I think the problem was Councilmember Glass brought up was the timing issue potentially. So you could do both. I mean, maybe we're not imagining something. You could say those three shops and then also institute the waiver process. So I could, you know, move that if that's what the consensus.
Why would you need to include the waiver process if you exempted those three types of businesses?
I was just saying if there's something that we're not thinking about, you know, that was my, but there might not be.
Well, I think the question was social distancing. The testimony that we heard from the business owner said he uses social distancing, which is terrific. Another business might not. And I guess that would be the hook. We don't have a social distancing requirement anymore indoors. So if we want to allow this with some kind of social distancing, which I really appreciated the testimony that we heard, then we would need a letter of approval to specify what those requirements would be, right?
Yeah, and that is a CDC recommendation. The 6 feet indoors is still a CDC recommendation.
I think that the team could approve things for the limited number of these kinds of applicants relatively quickly. And if there are other applicants, they can postpone those until, you know, they have time to get to them. But in the meantime, I think they know the will of the body is to find an appropriate way to allow it. And they could receive those, you know. I hear the concern that the ban goes into effect immediately, but there's even, anyway.
So just the waiver process then is what you're saying, Councilor?
I think so. Personally, just from what I've heard, I'd recommend the waiver. You know, and we ask them to please consider the applications in an expedited manner, and hopefully this can work out quickly. That would be my recommendation.
Yeah, I agree.
Guys, there are only 4 or 5 shops in the entire county anyway. So, I mean, we're talking about a very small subset. That's all there are.
Right. So,
exactly. So it shouldn't be hard to.
Can I move the waiver process that we used before in light?
Sorry, just going to chime in really quick.
I'm sorry. Council Vice President Albornoz was trying to get in.
Thank you. I agree with the waiver process, but we also, as our county attorney noted, we have to be realistic about the turnaround time and also the precedent it sets for other waivers moving forward. The waiver process before overwhelmed our team, and they ended up having to become experts in everything imaginable. So I think we just, in this case, because it's so limited, I support the notion, but I think only in this case will I support this motion, because there were people that went through the waiver process before that were understandably very frustrated with that process because they felt that it was not uniformly applied, even though everyone did their best effort, and we just need to be careful down this road. So I'll support this motion, but probably not future motions regarding waiver processes unless we provide very clear parameters.
Okay, so Ms. Wellens, what would it say?
So yeah, Mr. President, that's what I'm trying to find, the waiver language from your prior orders. And just to be clear, the intent is that this waiver process would apply across the board to any type of business. It's not limited to the smoking facilities, correct?
That is the motion, but I also agree with Councilmember Albornoz that we are not intending to create something that any business that just doesn't like this can come apply. You know, we're doing this to provide a very narrow exception, as well as the possibility that there could be another very narrow exception that we haven't imagined. But we are not seeking to, you know, allow for every different type of business to modify this rule.
Correct.
Could I maybe make a suggestion on if we narrow it to the whole purpose of this order is to follow the CDC guidelines. That is literally why we're here today. The CDC changed their guidelines, and we have said from the beginning that we would follow CDC guidelines and public health guidance. So perhaps if we wanted to tailor this, we would tailor it to a letter of approval that follows CDC, you know, exemptions may be granted that follow CDC guidelines through a letter of approval process. And then the county would not have to spend a lot of time deliberating over something that is clearly prohibited under CDC guidelines. I'm just suggesting that it would be consistent with the rest of the order.
Yeah, and that also gets social distancing.
The distancing would be part of it. Exactly. That was my thinking. Because I was originally, if we weren't going to do a letter of approval, I was going to say following CDC guidelines, including social distancing. Right. But this would be another way to do it. I think that would tailor it personally, but I'm open to hear other thoughts.
No, that makes sense to me. I mean, so we would be saying a letter of approval process, whatever the language was before, consistent with CDC guidelines. So I'll move that as an amendment.
Mr. President, I mean, I believe in terms of the nuts and bolts of what the precise amendment, I think we just need to add a subsection to the exemptions, another Roman numeral saying, you know, essentially adding pursuant to a letter of approval under paragraph X, we're going to add a new paragraph and then mirror the prior language that we've had in prior drafts about letter of approval. If you'd like, I can read that into the record, but we will add to that consistent with CDC guidance because, the prior language we used didn't have that caveat.
Yep. Okay. That sounds great.
Okay, so do we know? I move it. Someone second, if we can vote on it.
Councilmember Jawanda moves.
Second.
Councilmember Raymer seconds. All those in favor of this amendment, please raise your hand.
Aye.
Aye, great. That's unanimous. All those in favor of the resolution as amended, please raise your hand.
I'm in a roll call vote, Ms.
I beg your pardon. I was on a roll. Madam Clerk, can you call the roll?
Yes. Mr. Glass?
Yes.
Mr. Glass votes yes. Mr. Delando?
Yes.
Mr. Delando votes yes. Mr. Reamer?
Yes.
Mr. Reamer votes yes. Ms. Navarro?
Yes.
Ms. Navarro votes yes. Mr. Rice?
Yes.
Mr. Rice votes yes. Mr. Friesen?
Yes.
Mr. Friesen votes yes. Mr. Katz?
Yes.
Mr. Katz votes yes. Mr. Albenhouse?
Yes.
Mr. Albenhouse votes yes. And Mr. Hufford?
Yes.
Mr. Hucker votes yes.
Okay, that is unanimous. All right, colleagues, very productive day of recess. I think unless there's any other business or announcements, I think we're adjourned. All right, thanks everybody.
Thanks,
Take
Kelsey.
care, everybody.